Good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is COVID-19 World News. In this presentation, we are going to be talking about hyperimmune globulin and monoclonal antibodies. So let us begin. When the coronavirus infects a person, the body responds by producing antibodies. These antibodies fight against the virus, reduce the virus multiplication, and there are different kinds of antibodies that are produced during the course of a COVID-19 infection. In the immediate phase, like from the beginning of the onset of symptoms, the body responds by producing what are known as IgM, or the short-term antibodies. These antibodies prevent the virus from entering the cells, and it prevents the virus from multiplying and making the person sick. Similarly, there are also antibodies against the spike proteins that we have seen in the pictures, and also against this nucleic acid, which is the RNA sequence of the virus, which tells itself to multiply once it finds an appropriate host, such as the lung cells or the blood vessel cells. This IgM, which is the short-term immediate antibody, it rises by the end of the first week after the symptoms, and then it gradually comes down. At the same time, by the beginning of the first week or the second week, the IgG, which is the long-lasting antibody, starts to rise, and it fights against the virus. And this antibody may continue for several months and thus provide protection against reinfection from the coronavirus. However, there are times when the virus load may be so much, the body's antibody response may not be adequate to completely reduce this virus onslaught on the lungs and the rest of the body. And in those circumstances, supplementing the natural defense mechanism with antibodies from outside is one way to reduce the viral multiplication, to reduce the viral damage of lungs and other tissues, and reduce the duration of the illness. There are two kinds of antibodies that are available, namely hyperimmune globulin and monoclonal antibodies. Let's talk about hyperimmune globulin. Hyperimmune globulin is basically a protein. It is a concentrated version of the immune body found in plasma of a person who has recovered from the COVID-19 infection. Once you are exposed to the virus, your body produces antibodies. These IgG and IgM antibodies circulate in the blood, and when you take the plasma out for transfusion to provide these antibodies, that's essentially you are providing these immune globulins to fight against the virus. Whereas the hyperimmune globulin is a concept of concentrating this immune globulin from large sources of plasma so that it can be given using a much lesser volume. Here's an example of how a hyperimmune globulin is produced. We have talked about plasma transfusion for patients with the COVID-19 infection to provide these antibodies from an external source. So basically, you take the plasma from the patient, then you check for any type of infections. After that, the plasma is transfused, generally 1 to 2 units, to provide that antibody protection against the virus in the early stages. It works good when it's given in the first few days after the onset of symptoms, and thus reduce the viral multiplication, reduce the severity of the illness, and help in better or quicker recovery. Whereas the concept of hyperimmune globulin, it takes plasma from several sources and just extracts these immune globulins and make a concentrated version of the immune globulin known as the hyperimmune globulin. It has the same antibodies found in the plasma, but now you can preserve it so that this can be transported to other places and given to patients with acute infections. What are the advantages of hyperimmune globulin? There's no need for doing the blood typing as we would need when we transfuse plasma. It provides passive immunity by providing the antibodies from an external source in case you have a overwhelming viral infection. And these antibodies can last for several months. Hyperimmune globulin has been used in conditions like rabies, pneumonia, measles, polio, hepatitis, and a few other conditions. Hyperimmune globulin is obviously produced in the laboratory. There's a significant cost involved in collecting and processing large samples of plasma, and it is given as a single dose. The advantages of hyperimmune globulins are it has less contamination and less pathogens. Since you're isolating only the antibodies, it doesn't have all the rest of the stuff in the plasma, so there is less chance of having a contamination or like a virus or a bacteria. The quantity is small. It has a concentrated titer of antibodies. It can be potentially given as an intramuscular injection. The beauty of this is it can be stored and shipped to remote places where it can be used, where you don't have to transport plasma. Now let's talk about monoclonal antibodies. What are monoclonal antibodies? Again, these are all antibodies, but the beauty of monoclonal antibodies is it is synthesized in the laboratory. It acts like human antibodies and provide the immune response or the immune protection against a virus infection. The monoclonal antibodies have a Y-shaped appearance. They tag on to these spike proteins and thus prevent the virus from getting into the cells. That is the most important function of the antibody. The main function is to prevent the virus from getting inside the cell and using the cell materials to replicate itself, and in the process destroying the cell. If you can prevent the virus from getting into the cell, then there is less tissue damage, and these viruses are taken away by the white blood or broken up by the white blood cells. It reduces the symptoms and it reduces the length of stay. And here's a picture showing these Y-shaped antibodies attaching themselves to the spike proteins and thus preventing the virus from entering the lung epithelial cells or the endothelial cells. Monoclonal antibodies are given intravenously. Since monoclonal antibodies are proteins, there's a small risk of having a reaction. That is something that needs to be watched for. There are different ways in which antibodies can be targeted against coronavirus. We already talked about the spike antibodies. There is another kind of antibody known which acts against the RNA of the virus, which is the sort of the brain containing the amino acid sequence which uses the host cell products to replicate itself. These antibodies can be measured using different kinds of measurements. One of them is bioassay, that is looking at whether these antibodies can prevent the virus viability. Neutralizing antibodies look at the effect on the viral proteins like the RNA or the spike proteins. And there are serological assays which look at how well these antibodies bind to an agent, a testing agent. Hyperimmune globulin products are actively used in research, Mount Sinai is launching a Hyperimmune Globulin project, which has been funded by the Department of Defense. South Korea is also testing Hyperimmune Globulin. Grifols, which is one of the lead Hyperimmune Globulin companies, is also testing Hyperimmune Globulins in patients with COVID-19 infection. And GigaGen is using a different technique of recombinant Hyperimmune Globulin, which is produced in the laboratory using two different strains of the DNA molecules. The advantage of recombinant hyperimmune globulin, it is 100 times more potent than convalescent plasma antibodies. Since it is produced in the laboratory, millions of doses can be produced using a very small sample of plasma from donors. The advantage of recombinant hyperimmune globulin is it is pure, it is consistent, and its potency is reliable and reproducible. Monoclonal antibodies are known as MAPs. Typically, they have 2 or 3 antibodies that are easy to manufacture, and they are safe and non-toxic. We heard about Regeneron, which was given to President Trump. It is a combination of 2 monoclonal antibodies. It reduces the viral load, as I told you. It reduces the time to alleviate symptoms. It can also be used in non-hospitalized patients. So, ladies and gentlemen, this is a brief summary of antibodies, hyperimmune globulin, and monoclonal antibodies. Please do take a look at my book, COVID-19 Pandemic. It's going to be available in Amazon in November. And you have been watching COVID-19 World News. I am Dr. Nik Nikam from Houston. And please do subscribe to our YouTube channel. We will see you next time. Thank you so much for your time.